So I guess you can look at the foot pain or analyzing it in different ways. You can look at the nature of the pain, for example. So we can get sharp pain. Sharp pain usually happens when there are things like impingement, two bits of bone hitting against each other. They can cause a sharp pain. An example would be pain at the front of the ankle joint. It could happen when tendons are overworked as well. So it can happen on the outside of the ankle in conditions like ankle instability. You can also get a deep, dull pain. Deep, dull ache comes from a joint that is arthritic or that is a little bit degenerate. It can also happen if there are cartilage lesions within the joint. This is a type of pain that the patient cannot pinpoint. A different type of pain is burning pain, for example. Burning pain happens usually when nerves or tendons are overstretched. Another type of pain is nerve type pain, which can present like an electric type pain, where the patient can usually have other symptoms like pins and needles. They usually happen when nerves are trapped. You can also look at pain in a different way as to how it started. So acute pain can happen following injuries or in inflammatory conditions, whereas gradual pain can happen secondary to a problem that has been gradually getting worse over a period of time. So things like degenerate type pains or joints that are being arthritic, for example. You can also look at the location of the pain. That's another way of analyzing foot and ankle pain. So a forefoot pain, for example, usually happens because of abnormal loading across the ball of the foot. Big toe pain, that can usually present if there are arthritic changes in the big toe joint or secondary to inflammatory problems like gout, for example. Pain at the front of the ankle, that can happen secondary to things like arthritic joints or impingement at the front of the ankle. Outside or lateral ankle pain can happen secondary to things like instability. Arch pain can happen secondary to malalignment problems like flat foot. Heel pain can happen secondary to plantar fasciitis or so. So there are so many different causes of pain in the foot and ankle. The best way is to have a very detailed history, to take a very detailed history and a detailed examination to be able to analyze that pain and know exactly where it's coming from. Again, there are a lot of causes why somebody would have a sore foot or a sore ankle without having an injury. A common cause, for example, is malalignment. If somebody is slightly skewed, like patients who are flat-footed or patients who have a high arch, these patients can quite commonly present with pain on either sides of the ankle because of abnormal loading or tendons that are a little bit stretched. You can also get pain if there is abnormal load distribution across the foot. A classic example here is forefoot pain. So if one of the metatarsal heads, or the metatarsal heads are the equivalents of the knuckles in the foot, and again, if one of them is taking more weight, that can cause some pain. Arthritis type pain. This is a pain that keeps building up when joints are degenerate, and again, here, sometimes there are no history of injuries at all. Inflammatory pain. Inflammatory pain can happen because of medical problems like gout, for example. Infection. Infection can happen in the foot in a variety of ways. A very common form of infection is infection around the nails, for example. Obviously, there are more serious causes of pain that can present without injury, like tumors. So if there are any masses or swellings, again, we need to take a very good history and examine the foot and ankle thoroughly to be able to analyze exactly why is the foot sore. So the majority of the pain that happens in the foot or the ankle is trivial pain. Trivial pain is more of an ache. It is generally mild. If it happens for a short period of time and then it goes away. So we would need to start to think that this pain is more serious if the pain is persistent, and particularly if that pain is getting worse. Also, the intensity of the pain. So pain that is quite severe is unlikely to be a trivial pain. So when the pain starts to affect things like sleep or impact on activities of daily living, that means that the pain is a bit more serious. Also, when the pain starts to affect the function, so a pain that is affecting the way someone is walking, affecting their ability to put shoes on, or that types of pain that are happen concomitant to other problems. For example, pain that happens with instability. So somebody feels that the ankle is a bit unstable. Here, the pain can be quite serious because they can sustain another injury. They can cumulatively cause a problem. The last thing that comes to my mind would be if there is any visible or palpable changes in the foot. So if somebody notices a lump or a mass, if the foot is red or hot, if there is clear swelling in the foot. These are all things that can make us maybe think that there is a more serious cause of the pain, like infection, like a clot, like a fracture or a stress fracture, circulation problems, or even tumors. So I think the way that you need to maybe answer this question is how should we approach the pain in the foot? So ideally, we need to start with a very good history, very detailed examination, and then we order any investigations that uh, are required. Investigations that are quite common in the foot and ankle are things like X-rays or scans, like an ultrasound scan, MRI scan, and so on. And then we have to reach a diagnosis. So once we reach a diagnosis, then we know exactly why is the foot sore. Here, the treatment can go into certain categories. So the first is just giving the patient some advice, explaining to them what is wrong, why are they sore, and then that what comes under that as well is what can they do, what should they avoid, should they look after their weight, for example, how can they modify their activities of daily living, how can they change or adopt new forms of exercise, and that is a very big part of the treatment. The next part is how can we support the foot and the ankle until it heals. So you're speaking about things like using help from allied health professionals, so physiotherapists, podiatrists, orthotists. Do we need insoles, things like that. Surgery tends to come when there is a problem that we cannot fix with a conservative treatment, or when the pain or the problem is quite significant. And the target of the surgery here would be to improve the pain and to restore the function. And yes, there are a lot of operations that we do that are extremely efficient in fixing the pain. Examples of those, for example, are things like total ankle replacements. So if somebody's got a very arthritic ankle, you replace their ankle, the pain almost disappears. If you have a big neuroma, for example, in the forefoot, here the pain is quite significant. The patient feels as if they're walking on a pebble, the toes are numb. And again, once you remove that neuroma, the pain almost completely disappears. These are good types of procedures that examples of really quite efficient procedures against fixing pain. So again, we spoke about the foot and ankle as a very wide spectrum, and the foot and ankle covers a wide spectrum of pathologies, and subsequently there is a very wide spectrum of procedures or operations that we actually do. So, and depending on what is the problem, then we can suggest a different type of procedure. So the common procedures that we do, for example, are things like osteotomies. Osteotomies means breaking bones and realigning them. So this is very efficient when there is a malalignment problem. We can also fuse or replace joints. This is very efficient when a joint is very arthritic or damaged. We can release nerves. These are, again, very efficient if a nerve is trapped, for example. Repairing ligaments. Here, again, when somebody's got instability, repairing a ligament restores the stability in the ankle joint and can give excellent function. Reconstruction of cartilage lesions, for example, focal areas of cartilage damage that we can fix. Removing a soft tissue swelling or a mass. So what is involved in the surgery obviously depends on what is actually being done. So we have a very wide spectrum. Some of the operations are, the majority of our operations actually now are day case procedures. The patients are able to fully weight bear afterwards, and they are back to their day-to-day activities within just a few days. The more complex procedures are usually things like fusing a big joint. These are much bigger procedures in terms of the recovery. The patients might need to be non-weight bearing for periods up to 6 weeks. They might need to be in plaster or immobilization for up to 12 weeks, and the recovery could take a good 4 to 6 months, for example.